Dr. Collins, what percentage of revenue do private insurance companies spend on administrative costs?
Between about 17 to 18% of spending in private insurance plans.
So if I pay my insurance company $100, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, $17 go to administrative costs. What about Medicare? What do they spend on administrative costs?
That range is about 3 to 5%.
3 to 5%. About 3 to 5%, right here. And if we look at just billing costs, just billing and insurance costs, Medicare is at 1%. Wait, private companies spend 17 times more on administrative costs than Medicare? What are private insurance companies spending on that Medicare is not? Does Medicare spend hundreds of millions of dollars on television advertisements like private insurance does? Dr. Collins?
No.
Does Medicare spend millions of dollars on stock buybacks to shareholders?
No.
Does Medicare spend money on marketing? Private insurance likes to put its name on stadiums and PGA tournaments. Is there a Medicare arena?
No.
Does Medicare spend $23 million on executive pay like private insurance companies do?
No.
We know how much it costs to run a high-quality health insurance program. $1. Out of $100, research shows that Medicare spends 1.1% on administrative costs. We spend $4 trillion on healthcare every year. We could save $200 billion on administrative costs with Medicare for All. And those savings, they could go to expand Medicare. We could spend that money to let patients see dentists. We could spend that money to let patients pay for hearing aids, to help older adults afford eyeglasses, to bring down the cost of prescription drugs, to finally pay mental health professionals for the work they do. Instead, all this money is wasted. We're not talking about paying to keep the lights on in operating rooms or improving the quality of care. All this money is used to pay big insurance to push paper. It's death by 200 billion paper cuts. Dr. Sachs, what is it about the U.S. market that leads to these sky-high administrative costs?
Congresswoman, there is no market. These are local, concentrated providers that have tremendous power to set their prices and to set extraordinary salaries. We should contemplate that the so-called not-for-profits in this country pay their hospital directors $5 million. This is unbelievable. And so this is why these costs why the prices are so high. The administrative costs are so high because we don't have a system.
Dear friends, you need to be aware of this. Experts have announced that there are 4 Social Security mistakes that can cost you thousands of dollars. All recipients of Social Security are expected to receive another direct payment very soon. Both Republicans and Democrats are starting to change their minds on how Social Security should be funded. My dear friends, please do me a big favor and watch until the end of this video to hear about all of the details. Also, to say thank you for being part of this community. I will be announcing several winners in a video later today for the Walmart gift card giveaway. If you would like to enter these weekly giveaway, friends, please click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning these giveaways. Social Security supports more than 70 million Americans, ranging from retirees to disabled individuals and children. Nearly every week, new batches of payments are sent out, with the next deposit arriving on November 22nd. But it's also an incredibly complex system, with an operations manual that is 20,000 pages long, covering a tangle of 2,700 rules that can easily trip up claimants and cost them tens of thousands of dollars in lost benefits. A Boston University economist says that in some cases, the errors are not the fault of beneficiaries, but stem from the Social Security Administration's own missteps. Yet claimants have little recourse for fixing the problem or otherwise protecting themselves. There's a lot at stake in improving the system. The Boston University economist told CBS News that Social Security is often a person's biggest financial asset, aside from home ownership, and the steady stream of monthly income keeps millions of seniors from slipping into poverty. But the program can be opaque and perhaps unintentionally encourage certain choices that cause people to lose out on tens of thousands of dollars in their benefits. The mistakes can range from claiming benefits too early to following the wrong advice, such as claiming both a survivor's benefit and retirement benefit at the same time, which can also lead to a loss in future payouts. The SSA said in a statement to CBS News that improving its business processes to serve our customers better remains a top priority. So this may be the single largest issue impacting Americans because Social Security allows people to begin collecting their benefits when they turn age 62, or about 5 years before the full retirement age for most Americans. Though by claiming Social Security early, your monthly benefits will be shaved by 30%. Individuals can also wait to claim Social Security until they are 70 years old, when they receive the maximum payout, about 76% higher than at age 62. But only about 6% of Americans wait until they turn 70 to claim Social Security. Many analysts say that the Social Security Administration may inadvertently nudge people into claiming too early by providing a life expectancy calculator that give the average number of additional years you could live. He said people should claim Social Security based on the maximum number of years they could live, not the average. On average, claiming too early can cost you $182,000 in lost benefits. Another Social Security rule that can trip up older Americans is the earnings test, which states that people who claim them before their full retirement age and then continue to work will face a heavy tax if they earn above a fairly low income threshold. In 2023, that earnings test is $21,240, which means people who collect Social Security before age 67 will get $1 deducted from their Social Security payments for every $2 they earn above that limit. That often dissuades older workers from continuing to work after they claim, given that they fear losing a chunk of income to this tax. This issue impacts about 1 million Social Security recipients each year and can cause financial hardships and stress. This happens when Social Security overpays beneficiaries, who typically find out years later when the SSA sends a letter demanding repayment, even if it was not their fault. Sometimes the fault sits with the SSA, as detailed in this 2020 report from the Social Security Administration's Inspector General that found that employees sometimes entered the wrong information into the SSA system or incorrectly calculated benefits. The SSA also notes that overpayments can happen for many reasons, most often when a beneficiary does not report earnings or other changes that can impact their benefits. But if this happens, the recipient will have to pay up. And if you want to appeal, it can take months or years to clear up, with no guarantee that it will be resolved in your favor. Well, my awesome and amazing friends, that is the end of my daily stimulus update video for today. Thank you, friends, for being part of this community. To say thank you and to show my appreciation, every Friday I will be announcing several winners for the Walmart gift card giveaway. If you would like to enter the weekly giveaway, friends, please click and like several of my videos and then comment below the keyword of each video that you watch. The more videos that you comment on, friends, the greater your chances of winning these giveaways. Thank you, and have a wonderful and very blessed Friday.